Good morning, everyone. Thank you for joining us today. Achieving healthy people in healthy communities requires a comprehensive and collaborative approach beyond individual well being to address the broader factors that affect our health and society in our environment. It entails promoting physical fitness, disease prevention, and creating inclusive, safe, and supportive environments that foster mental and social well being. As reported in the Joint Strategic Needs Assessment Report, non-communicable diseases such as heart attacks and strokes, cancers, and dementia are leading causes of death in Bermuda, to which diabetes and chronic kidney disease can also be added to leading causes of ill health. The Ministry of Health is committed to ensuring equitable access to quality, affordable health care in our community, and this is our top priority. Aligned with the central theme of this year's throne speech, Serving the People, we have outlined some vital initiatives with our primary focus being on collecting health system data that will inform evidence-based policies and interventions. Our current data collection efforts are insufficient for fully assessing our our present and future healthcare and social care needs and informing sound decision making. This became evident through the development of the Joint Strategic Needs Assessment earlier this year. However, moving forward, we are committed to enhancing our data collection with a specific focus on gathering crucial information that assists the ministry with a better understanding of where we need to enhance our services and ultimately how we can make healthcare more efficient, cost-effective for both businesses and consumers. Building on the success of the Bermuda Health Council's Provider Advantage program, which is a voluntary program, the ministry and the council are working with health service providers and health business licensing, and the results will be vastly improved information Also, the ministry will advance legislation that supports the collection of data required to regulate medical co-payments for the most vulnerable individuals in our community. Prevention and early detection and treatment of disease can lead to better health outcomes, but the cost of healthcare services discourages people from seeing the doctor. For our seniors being on a fixed income, it can be especially challenging, and it can result in delays or no care. Healthcare inflation only serves to exacerbate the cost of care. The purpose of the legislation is to support data collection, is to understand the factors influencing healthcare costs so that the medical copays can be more predictable and manageable for our most vulnerable residents. In all respects, the collection of accurate data is key to informed decision making. Also in this year's throne speech, the former chief medical officer was cited regarding health disparities in Bermuda. Dr. Olaniyi emphasized the significance of addressing health inequalities with a specific focus on the four primary risk factors associated with preventative chronic diseases, namely tobacco consumption, excessive alcohol consumption, inadequate nutrition, and lack of physical activity. He went on to say that, quote, in Bermuda, there's a lack of robust population-wide data that links the prevalence of these risk factors with socioeconomic data. This is evidently a requirement for further evidence-based policies to address these risk factors, particularly for the most deprived, who are likely to be at the greatest risk. We know that evidence-based policies and interventions can, over time, help to reduce the burden of chronic diseases in our community. And as such, the Ministry of Health will undertake the STEPS 2024 Population Health Survey. STEP survey offers a solid foundation of evidence concerning our critical public health concerns, particularly in the realm of preventing and managing chronic non-communicable diseases and illnesses such as diabetes, cardiovascular disease, and specific types of cancers. Additionally, these surveys provide a means to monitor the trends and extent of factors that either increase or safeguard our overall health within our general population. This is achieved by examining various behavioral elements, including dietary health habits, physical activity levels, alcohol consumption, tobacco usage, and access to healthcare services, including screening opportunities. By developing and focusing on evidence-based policies and interventions, the Ministry of Health aims to reduce the burden of chronic diseases in our community, leading to better public health outcomes and improved quality of life for our population. Lastly, the Ministry of Health remains committed to achieving universal health coverage to ensure that all residents have access to quality, affordable healthcare services when they need them without suffering financial hardship. In the year ahead, the UHC program will pursue some important goals. To start, in collaboration with our healthcare stakeholders, we will determine the healthcare services to be included in the core benefits package for all. This is a package of healthcare services which all residents will be able to access. We will also figure out how much these services will cost, and we will explore various ways to make these vital healthcare services available to everyone in a sustainable way, while also evaluating how our options will impact the economy. Before I close today, I wish to restate the need for strengthening Bermuda's overall healthcare system, and it is critical. It is essential to improving our health outcomes, increasing efficiency and effectiveness in the service system, and experiencing quality, affordable healthcare. Our healthcare system comes at a high cost, and it is not reflected by our health outcomes, and that must change. The Bermuda Health Strategy 2022-2027 supports the core vision of healthy people and healthy communities, and it sets out 8 strategic principles that are intended to set us on the new path towards equitable, accessible, and sustainable health systems for this island. And as a reminder, those 8 principles are as follows: promoting healthy living and preventative care, focusing on person-centered care, understanding our population's health needs, providing access to healthcare coverage, strengthening our healthcare workforce, harnessing healthcare technology, partnership and collaborative working, and preventing wasteful care and promoting efficiency. I'm pleased to say that we are making significant progress towards achieving all 8 strategic principles, which will pave the way for a stronger and more sustainable health system in Bermuda. Our initiatives in the coming legislative year will enhance health outcomes as we continue to work towards healthy people in healthy communities. Thank you.
Morning, Minister.
Good morning, Sarah.
Question about the STEP survey. So we've seen a few STEP surveys before. I know there was one in 2014, and then I believe that one was begun in 2019.
That's
but
correct.
that because of COVID, that couldn't be completed.
Correct.
Could you tell me a little bit about, were there any more? Do you know, were there any more?
No,
That
the first one
first-
was, you're correct, in 2014.
Yeah, okay. So in terms of the work done in the 2019 one, was much headway made with that one, or?
No, unfortunately, it started in the fall of 2019, and then you'll know what happened in 2020 in January. So it did not get, it didn't even get commenced. However, what's more important is the fact that not only is the STEPS survey critically important, and we work with PAHO to produce the survey, but what we're really hoping will be promoted is that if you get called by the surveyors to participate in the survey, please do so, because this is going to provide us with extremely important population health data that will help to measure where we are and to set the stage insofar as how to best improve our health outcomes in Bermuda. So we really want people to participate in the survey.
How many people will be asked to participate?
That's, I can tell from the last survey.
It was about 1,000 families.
I don't have that information in front of me right now. However, we are hoping that we'll have high participation. 2,000.
2,000. Okay. And do you have any idea the cost of these, how much it costs to carry out these surveys?
Like
This
I
one?
said, yeah, we are working within, it's a PAHU survey. However, we are anticipated that approximately $100,000 to $120,000 will be the cost for completing the 2024 STEP survey.
Okay. And going back to the 2014 STEP survey, presuming it had the similar hopes for creating policy as a result of the outcome of that survey. So were any policies implemented as a direct result of the last STEP survey?
Yes, and you're absolutely correct. The information that's gathered from STEPS will help us with our health promotion offices, our health promotion, oh my dear, with health promotion efforts to help to drive everything is geared towards having an improvement in our health outcomes. So for example, following from the 2014 STEP survey, we unfortunately recognize that there's a high prevalence of hypertension on our island. So we were able to produce the HEARTS program, which is a program that's designed to help to address and minimize the impact of hypertension. So it is a very important survey. And again, we just need to ensure that persons, if you're called, please participate. And it will help to guide our public health decisions. It will help to guide health promotion. We'll be able to see where we are. A lot of the data that you hear me quote constantly insofar as the prevalence of hypertension, chronic disease, obesity, et cetera, is from the 2014 survey. So we need to be able to update that and see where our population health standards are right now.
Okay. I don't know if you could just clarify something with the health strategy 22-27. There appears to be quite a lot of statistics within that report. So that has health statistics within there. Is that correct?
The Bermuda Health Strategy laid out 8 principles that are critically important for us to improve and strengthen our health system.
Was that based on the data from the 2014 STEPS?
No, that's separate. One of the Bermuda Health Strategy just speak to the need for us to be able to gather data, right? But of those 8 specific goals, one of them related to understanding your population's needs. And in that regard, that's how the JSNA, the Joint Strategic Needs Assessment, was completed. And it allowed us to have a lot of information and gather information with respect to our social determinants of health and other population data. But the STEPS, on the other hand, is specifically geared to us gathering data as it relates to chronic non-communicable diseases.
Okay. And you spoke a little on universal health care there. Obviously, it's a hugely pressing issue.
Yes.
Being able to afford health care. And you recently did an interview with the Royal Gazette where you said that some core questions remain, one being how it's going to be paid for. Are you any further along in terms of determining that?
No, not yet, Sarah. What we've done under the UHC steering committee, there are 5 health forums. One of those forums is specifically geared towards helping us, assess what the core benefits will be as we start to roll it out in April 2024. And one of the other forums is charged with helping us to assess amongst the stakeholders how much it's going to cost for these particular core benefits. So all of that is a work in progress. The team is extremely committed to advancing our UHC, which is, again, an initiative that this government is truly committed to. We did have a blip because of COVID, but they've picked up the ball and they're running feverishly with it.
Yeah, and an expected timeline for the full implementation?
We've always maintained that it's going to be several years. We've anticipated many other jurisdictions that are on the same trajectory towards universal health coverage, which is consistent with the 1948 Constitution of the WHO, which is saying health is a human right. Many jurisdictions that are on the same trajectory, it takes several years for full implementation. The advantage that we have here in Bermuda is twofold. One is that we can look at best practice internationally of other jurisdictions that have forged ahead prior to us. And 2, we have a very strong, sustainable health system. So we're not starting from scratch. So we are at an advantage in that regard, but it's certainly something that we've anticipated will take several years for full implementation.
Okay, just finally, in terms of diabetes, that as long as I've been here, it's been a huge problem. I mean, the statistics always just seems to be 13% of the population. I mean, this is at least 15 years. It's been the same. So why hasn't any headway been made on reducing that, or has any headway? You know, what more can be done to reduce that figure?
I'm glad you asked that question. When we complete the STEP survey, we'll see if that figure remains. The figure that we've been quoting is based on the 2014 STEP survey. We don't know whether or not that'll increase or decrease. However, we are doing what we can insofar as health promotion. We're trying to encourage people because diabetes is largely preventable, as you know, and it's a sedentary disease. Persons that unfortunately don't take care of their health, or but may perhaps not have proper dietary progress. There's a number of issues that tie to it, but it's all something that's controllable. And I think that we can each and every one of us do our own part to help to reduce the prevalence of diabetes. Unfortunately, it's costing us a lot. We're spending far too much on our healthcare system. I think we're like number 3 in the OECD with below knee amputations as a direct result of diabetes. So we all need to help do our part. And I think it's important, you know, the press, exactly, you can help us with respect to that. And I see a lot of articles in the Royal Gazette regularly insofar as helping to promote health, but it's something that requires personal responsibility, because each and every one of us are helping to pay for the exorbitant price that we're paying in healthcare related specifically to preventable diseases such as diabetes.
Okay, thank you.
Thanks, Sarah.
Thank you, Sarah. We'll now have questions from the Bermuda Broadcasting Company.
Good morning, Minister.
Good morning.
In regards to the STEP survey, are you able to share when that will commence and when it will be completed?
We're looking for it to commence, I believe, in the beginning of the year, but the anticipation is that it will be completed within the 12 months within the 12-month frame.
Okay.
Again, and I have to emphasize this, so forgive me, if you get called, please, I'm asking members of the public to participate. It's not a critically difficult assessment. You know, you'll gather a lot of information about yourself and your own health outcomes. So I think it's important for persons that are getting called to participate, but we would anticipate that it will be completed within this calendar year. Not this calendar year, this fiscal year.
Of course, thank you. And will that survey mainly be conducted by telephone?
Actually, that's a very good question. Thank you. It is a personal survey. So they will come and they will measure your waistline and they will take your pressure. So there is some aspects of it that require one-on-one interaction because they need to physically assess and take your weight and take your measurements and so forth. So it's not just a verbal one. It is an interactive survey as well.
Of course. And speaking on the theme of making healthcare more cost-effective, you might be familiar, former Chief Medical Officer Dr. Oyinloyi recently did an interview with Bermuda Broadcasting where he suggested that we can address any over-provision of services by changing to an outcome-based payment model. For example, a doctor treating a diabetes patient is paid for completing the full set of diabetes tests rather than per clinical visit.
Mm-hmm.
Is that something that you're hoping to feature in your plans to reduce healthcare costs?
All of those are discussions that are critically important for us in assessing strengthening Bermuda's health system. Again, under the UHC structure, there is 5 health forums, and one of them specifically relates with the clinical senate, and they're charged with not only assessing what will be the core benefits package that's rolled out in April 2024, but also what are core services that are required to address some of the challenges that we have and to ensure as best as possible better health outcomes. Likewise, one of those 5 working groups also is dealing specifically with addressing the financial aspects of healthcare and how we can better get value for money and provide an efficient, effective healthcare system.
Thank you. And you noted the ministry remains committed to universal health coverage. I wonder if you could describe the progress of that for us. Have there been any main obstacles in the way of achieving this?
Thank you for that. With respect to universal health coverage, and we need to tie it back to the Bermuda Health, the health strategy, which had 8 strategic principles. And I think it's important that we identify all 8 of those principles. It's like if you're baking a cake and you have 8 ingredients and you forget the flour, you're not going to have a proper cake. Likewise, with respect to the Bermuda Health Strategy, we need to change the goalposts and make a more efficient, effective system so that we can improve health outcomes. Part of that includes 8 strategic principles that came from the Bermuda Health Strategy. One of those principles does relate specifically to providing universal health coverage, but the other principles are equally important as it relates to population data, understanding your starting points, promoting healthy living. Health promotion is very important. It's one thing to say, okay, we've got this universal health coverage and we're being able to provide access to healthcare for everyone, which is certainly an important principle. But if we're providing access to healthcare, but we're not addressing the other end insofar as how to prevent these type of non-communicable diseases, then we're failing. So all 8 of those strategic principles work hand in glove, and each one is equally important.
Thank you. That's everything.
Okay.
Thank you. Minister, do you want to say anything before we leave?
No, thank you, everyone. Again, I just have to do a plug for the STEP survey. There will be about 2,000 residents that will be called. It is an interactive survey. You will learn a lot of information. 1,000. Oh, you'll learn a lot of information about yourself and about the health outcomes that we're trying to improve. So again, if you're called for the STEP program, if you could please ensure that you answer the call. And then to Sarah's question with respect to the high instances of diabetes, unfortunately, that is something that's recognized in Bermuda, but it is also Diabetes Awareness Month. And the Diabetes Center is doing a lot of things to help promote diabetes and to promote how we can best counter it and avoid it through healthy lifestyle. Thank you very much.
Minister, that